Victor Hale had destroyed 11 careers before Dr. Maya Reeves walked through the doors of Sentinel Ridge Military Hospital. His voice could strip the confidence from a decorated combat medic in under 30 seconds. His eyes could find your weakness before you finished introducing yourself. For 3 years, he'd ruled this facility like a warlord in an expensive suit, and every person who worked under him had learned the same survival rule. Stay invisible, stay silent, and pray you never end up in his crosshairs. But Maya Reeves wasn't there to stay invisible. Before we continue, please subscribe to the channel and let us know where you're watching from in the comments. Enjoy the story. The November morning was the color of concrete when Maya pushed through the main entrance of Sentinel Ridge. Cold air followed her inside, carrying the scent of rain that hadn't quite decided to fall. Everything about her first impression suggested calm. Canvas messenger bag slung over one shoulder, worn but professional scrubs, dark hair pulled back in a simple knot. She thanked the security guard who checked her credentials. She smiled at the HR coordinator who handed her an orientation packet. When she introduced herself to the nursing supervisor on the second floor, her voice was gentle, almost musical, the kind of voice that would comfort a frightened soldier or steady a family receiving bad news. Her resume looked standard enough. Senior trauma nurse. 10 years of critical care experience. Most recently at a civilian hospital 2 states away. Excellent references. The hiring manager had been relieved to find someone willing to take the position. Sentinel Ridge's turnover rate had become legendary for all the wrong reasons. Beth Carrington pulled Maya aside before the morning briefing ended. Beth had kind eyes that carried too much knowledge, the look of someone who'd seen things they wished they could forget. "Listen," Beth said, her voice dropping to barely above a whisper. "There's something you need to know about Director Hale." Maya listened as Beth chose her words with the precision of someone who'd learned that careless speech had consequences. The stories came out in fragments. The temper that could erupt without warning. The public humiliations that left grown men shaking. The way questioning his decisions was career suicide. The 7 staff members who'd left in 6 months. The 2 complaints that had mysteriously vanished from HR files. "The best advice I can give you," Beth finished, glancing over her shoulder at the empty hallway, "is to stay off his radar entirely." Maya's response was simple. Almost too simple for the gravity of the warning. "I appreciate you looking out for me." What Beth didn't see was the way Maya's eyes tracked the corridor's sightlines, the way her weight settled into her stance with unconscious readiness, the way she'd already cataloged 3 exits and 2 potential choke points in the conversation. The morning unfolded in routine tasks. Maya oriented herself to supply rooms, medication protocols, patient tracking systems. She moved with an efficiency that suggested genuine competence, not rushed anxiety. Other nurses noticed the way she verified medications with meticulous care, the way she spoke to patients with a calm that seemed to reduce their blood pressure just by proximity. Then, at 10:47 a.m., Maya saw Victor Hale for the first time. He was standing in the corridor outside the supply depot, his posture rigid with fury. In front of him stood a young medic who couldn't have been more than 22, his face pale, his hands trembling as he tried to explain why an inventory count was off by 3 units. Hale's voice cut through the hallway like a blade. "Incompetence. Pure incompetence. Do you understand that soldiers depend on this facility? That your laziness could cost lives?" The medic stammered an apology. Hale stepped closer, invading his space, his voice dropping to something more dangerous than a shout. "You're a disgrace to this uniform. Get out of my sight." Maya watched from 30 feet away, apparently focused on reviewing a patient chart, but her eyes tracked every detail. The set of Hale's shoulders when he was building toward escalation. The particular edge in his voice that preceded threats. The way staff scattered like debris in a blast radius when he moved through the corridor. She was studying him the way a tactician studies terrain. At 2:15 p.m., the emergency call came through. Trauma incoming. Marine Corporal Danny Torres, 22 years old. Training accident. Severe arterial bleed to the right forearm. Maya was first to the trauma bay. When Torres arrived on the gurney, his face was ghost white. His forearm wrapped in field dressings, soaked crimson. The wound was catastrophic. The radial artery severed cleanly. Blood loss approaching the threshold of hypovolemic shock. Maya's hands moved with absolute precision. "I need 16-gauge IV access, 2 liters normal saline wide open, and type and cross for 4 units. Her voice carried a calm authority that made the attending physician glance at her twice. She worked the wound with movements that seemed like muscle memory. Pressure, clamp, exposure. Her hands didn't shake. Her breathing didn't elevate. While everyone else in the trauma bay operated on controlled urgency, Maya existed in a pocket of complete focus. "Arteries clamped," she announced. "We're stable for surgical repair." Torres would keep his arm. He'd keep his career. And the surgical team would later remark that the nurse's field stabilization was the finest they'd seen outside of a combat zone. Maya was stripping off her gloves when the trauma bay doors opened again. Victor Hale entered, his presence causing immediate tension in the room. He'd been reviewing surgical metrics on the 3rd floor when he'd heard about the trauma case. He liked to observe emergency responses. It gave him opportunities to evaluate staff performance, to find weaknesses he could exploit later. His eyes swept the bay, landing on Maya. She looked up from the equipment she was restocking, met his gaze for exactly 2 seconds, then returned to her task. It was nothing, really. Just a moment. But it was different from how everyone else in the room reacted to Hale. The attending physician, Ha. The break room on the 2nd floor had the particular sadness of a space designed for rest, but never used that way. Faded motivational posters about teamwork lined the walls. The coffee maker hadn't been cleaned in weeks. Maya sat alone at a corner table during her lunch break, reviewing patient charts, when Beth Carrington slid into the chair across from her. "You handled that trauma case beautifully this morning," Beth said. But her voice carried something heavier than a compliment. "Corporal Torres is lucky you were there." Maya looked up, recognizing the tone. Beth wanted to say something else. "Director Hale," Beth continued, glancing toward the door. "He's been at Sentinel Ridge for 3 years. Before that, he was at 2 other hospitals. Same pattern at both places." The story emerged in careful fragments. Hale had a talent for making facilities profitable, cutting costs, streamlining operations, delivering impressive quarterly reports to boards that measured success in numbers. But underneath those numbers was a culture of systematic fear. Staff turnover at catastrophic levels. Patient safety concerns buried under bureaucracy. Good people driven out or broken down. 7 staff members have left in the last 6 months, Beth said quietly. 2 of them filed formal complaints with HR before they resigned. Those complaints disappeared from the system within a week. Maya's expression remained neutral, but her eyes sharpened with focus. Disappeared how? No record they ever existed. I saw Jennifer Park. She's a respiratory therapist. I saw her submit a written complaint about verbal abuse. 3 days later, when she tried to follow up, HR told her there was no complaint on file. She resigned 2 weeks after that. Beth leaned forward, her voice barely above a whisper. "Maya, I'm telling you this because you seem like someone who cares about doing the right thing. But here, caring about the right thing can destroy your career. Hale has connections. His brother-in-law sits on the hospital board. He has relationships with defense contractors who fund this facility. When people challenge him, they don't just lose their jobs. They get blacklisted from military healthcare entirely." Maya absorbed the information with the calm attention of someone cataloging tactical intelligence. "Has anyone ever stood up to him successfully?" Beth's laugh was bitter. "No, people have tried. Dr. Marcus Chen questioned a staffing cut 2 years ago. Hale had him transferred to a satellite clinic in Alaska within a month. Nurse Sarah Okafor reported him for throwing medical equipment during a tantrum. She was terminated for insubordination before her shift ended that day." The conversation was interrupted by raised voices in the corridor. Maya and Beth emerged from the break room to see Hale cornering Lisa Park, the respiratory therapist Beth had mentioned. Lisa's back was against the wall, her face pale, her hands clutching a patient chart like a shield. Hale's voice was low, controlled, and venomous. "You followed the old ventilator protocol. I sent an email updating those parameters 3 days ago. I didn't receive—" Lisa began. "Are you calling me a liar?" Hale stepped closer, invading her personal space. "Are you suggesting I didn't send that email?" "No, sir. I'm just saying you're incompetent. You endangered a patient because you can't be bothered to read your emails. Do you understand how close you are to termination?" Lisa's eyes were filling with tears. Other staff members in the hallway had suddenly found urgent tasks that required their attention elsewhere. No one intervened. No one even made eye contact. Maya watched from 20 feet away, Her posture relaxed against the wall, apparently checking her phone, but she was memorizing everything. The way Hale positioned himself to physically intimidate, the specific language he used: incompetent, endangered, termination, calculated to destroy confidence. The way he waited until there were witnesses but knew those witnesses wouldn't act. This wasn't anger. This was a performance designed to maintain control through fear. The mandatory staff meeting that afternoon took place in the main conference room. 43 people packed into a space designed for 30. Hale stood at the front, a PowerPoint presentation glowing behind him showing new efficiency metrics he was implementing. Patient monitoring intervals will be adjusted to optimize staff workflow, Hale announced. Current protocols require vital sign checks every 2 hours for stable patients. We're extending that to every 4 hours. A young nurse named Private Jordan Chen shifted in his seat. Maya, sitting 2 rows behind him, saw his hand start to rise, then stop. He looked around at the silent faces surrounding him and lowered his hand. These changes will improve our operational efficiency by 18%, Hale continued, his tone brooking no discussion. Implementation begins Monday. No one spoke. No one asked questions. No one pointed out that extending monitoring intervals for military patients, many recovering from combat injuries with potential complications, was medically dangerous. The silence itself was a symptom of how thoroughly Hale had infected this facility. Maya sat alone in her car in the parking lot after her shift ended. Rain had finally started falling, drops tracing patterns across the windshield. She pulled a photograph from her wallet, herself in military dress uniform, younger, her expression carrying a certainty she'd had to rebuild after it was taken from her. She stared at the photograph for a long moment, then placed it on the dashboard. Her phone buzzed. Unknown number. The message was brief. He's done this before. Don't let him do it again. Maya read the message 3 times. Then she looked up through the rain-streaked windshield at the lit windows of Sentinel Ridge Military Hospital, where good people were learning to stay silent, and bad behavior was rewarded with power. She typed a single word in response. Received. Then Dr. Maya Reeves started her car and drove into the November darkness, already planning her next move. Sergeant First Class Amelia Grant arrived at Sentinel Ridge on a Tuesday morning via military medical transport from Landstuhl Regional Medical Center in Germany. Her chart told the clinical story. Shrapnel wounds from an IED strike outside Kandahar. 3 surgeries. Recovering well, but requiring continued monitoring for potential infection. Maya was assigned to her care on day 4 of Grant's stay. When she entered the room to perform the morning assessment, Grant was sitting upright in bed, her posture impossibly straight, despite the pain medication, her eyes tracking Maya's movement with the sharp attention of someone trained to read threats. "Good morning, Sergeant Grant," Maya said, her voice carrying that gentle warmth. "I'm going to check your vitals and your surgical sites." Grant nodded, but her eyes never left Maya's face. As Maya worked, checking the IV line, examining the healing wounds on Grant's left shoulder and rib cage, documenting everything with meticulous care, Grant's expression shifted from neutral assessment to something closer to recognition. "You move differently than the other nurses," Grant said finally. Maya's hands didn't pause. "Different how?" "Like you've done this under fire." Grant's voice was matter of fact, not accusatory. "Field medicine. You position yourself with sightlines to the door. You check equipment locations before you need them. That's not civilian training." Maya met Grant's eyes for a long moment. Then she smiled slightly. "Your wounds are healing beautifully. You're ahead of schedule." Grant smiled back, understanding the deflection for what it was. "Understood." Operational security. Over the next 3 days, a quiet rapport developed between them. Grant didn't ask direct questions, but she observed everything. The way Maya's hands moved with battlefield efficiency, the calm authority in her voice when coordinating with physicians, the particular way she scanned rooms that suggested training far beyond nursing school. On Friday afternoon, Maya was reviewing Grant's discharge timeline with the physical therapy team when Victor Hale appeared in the doorway of the nurses' station. "Dr. Reeves," he said, the title landing like an accusation. He'd learned Maya had a doctorate in nursing practice, which somehow offended him more than her simple competence. "Room 217. I need that bed cleared by 1800 hours." Room 217 was Amelia Grant's room. Maya looked up from the chart. "Sergeant Grant isn't scheduled for discharge until Monday." Her infection markers need another 48 hours of monitoring. Plans have changed. Senator Morrison's chief of staff is being transferred here from Walter Reed. He needs a private room. Maya's expression remained neutral. Sergeant Grant requires continued care. Moving her prematurely poses medical risk. Hale's jaw tightened. This isn't a request. It's a directive. Discharge her by 1800 or find another bed for her. There are no other private rooms available, and she needs isolation precautions because of her wound status. Maya's voice stayed level, professional. I can't discharge her until her medical team clears her. The nurse's station had gone silent. Beth Carrington froze mid-keystroke. Private Jordan Chen stopped restocking the supply cart. Everyone within earshot recognized the danger in Hale's sudden stillness. You're refusing a direct order? Hale's voice dropped to that particular frequency that preceded explosions. I'm following medical protocol. Maya stood, meeting his eyes with absolute steadiness. Sergeant Grant's care takes priority over administrative convenience. Hale's face flushed crimson. He took 3 steps forward, closing the distance between them until he stood less than 2 feet away, using his height to intimidate. His voice rose to a shout that echoed through the entire corridor. You have been here 1 week. 1 week. And you think you can tell me how to run my hospital? Do you have any idea who I am? What I can do to your career? Maya didn't step back. Didn't flinch. Didn't drop her gaze. I'm responsible for her care, Maya said quietly. She stays. The silence that followed was absolute. 40 feet away, a physician stopped mid-step. A medical student's pen hovered frozen over a chart. Beth's hand covered her mouth, her eyes wide with disbelief and something close to terror. No one at Sentinel Ridge had done this. No one had looked Victor Hale in the eye and said no. Not in 3 years. Not without immediately apologizing, backing down, begging for a second chance. Maya stood there, calm as deep water, waiting. Hale's voice came out strangled with rage. You're making a career-ending mistake. Do you understand me? I will personally see to it that you never work in military healthcare again. I'll have your credentials reviewed. I'll make sure every hospital in this network knows exactly what kind of insubordinate, arrogant... The patient stays until she's medically cleared, Maya repeated, her voice unchanged. Hale stared at her for 5 seconds that felt like 5 minutes. Then he turned and walked away, his footsteps sharp against the tile floor. But he paused at the end of the corridor, his final words carrying back with cold precision. You have no idea what you've just done to yourself. The moment he disappeared, movement returned to the floor like blood flow restored after a tourniquet release. Private Chen exhaled shakily. The physician shook his head and walked away. The medical student whispered something to a colleague. Beth appeared at Maya's side within seconds, her voice urgent and low. Can we talk? Now? They stepped into an empty patient room. Beth closed the door and turned to Maya, her expression a mixture of awe and fear. No one's done that in 3 years, Beth said. Maya, you need to understand what happens next. He's going to come for you. He's going to fabricate documentation, find witnesses who'll say whatever he wants, make your life here impossible until you quit or he fires you. That's what he does. Maya's expression finally shifted, revealing something beneath the calm. Not fear, but cold determination. Then let him come, she said quietly. Beth stared at her. You don't understand? I understand perfectly, Maya said. Someone has to stand up to him. Someone has to say enough. In room 217, Sergeant First Class Amelia Grant sat in her bed, listening to the aftermath of a confrontation she'd heard through the open door. She picked up her phone and typed a brief message to a secure military email address. Found her, the nurse you told me about. She's exactly what you said she'd be. The reply came back in 30 seconds. Good. Keep me informed. The retaliation began on Monday morning when Maya arrived for her shift and discovered she'd been reassigned. No longer the day shift with its structured routines and physician support. She was now working the overnight rotation, 11 p.m. to 7 a.m. And Thursday through Monday, the schedule universally recognized as punishment duty. Beth found her in the locker room, her expression apologetic. He changed the assignments personally. I tried to push back, but... It's fine, Maya said, her voice unchanged. She hung her jacket in her locker with the same calm efficiency she brought to everything. I've worked worse shifts. What Beth didn't know was that Maya had worked shifts under mortar fire, a schedule change barely registered. Over the next 6 days, Hale's campaign intensified. He appeared during Maya's rounds to question her clinical judgments in front of patients and colleagues. Why had she chosen that antibiotic? Was she certain about that dosage? Had she considered alternative approaches? Each question was phrased to sound reasonable, but delivered with a tone that implied incompetence. Maya responded to every challenge with the same professional composure, citing medical literature, explaining her clinical reasoning, never raising her voice or showing frustration. Her unshakable calm seemed to infuriate Hale more than defiance would have. He assigned her the most difficult patients, the ones requiring constant monitoring, complex medication regimens, families who needed extensive emotional support. He demanded documentation for routine decisions that other nurses made without explanation. He scheduled her for mandatory training sessions on her only days off. Maya completed every task flawlessly. On Wednesday afternoon, Private Jordan Chen found Maya restocking supplies in the medication room. The young medic's hands were shaking as he helped her organize IV tubing. "Can I ask you something?" Jordan's voice was barely above a whisper. Maya nodded, continuing her work. "How are you not terrified?" The words tumbled out. "He destroyed Corporal Martinez, the medic who had this job before me. Made up documentation about medication errors that never happened. Martinez couldn't find work anywhere after Hale blacklisted him. Everyone here knows it was fabricated, but no one said anything." Maya paused, turning to look at Jordan directly. "Fear is a tool. It only works if you give it power. But he has power. Real power. So do we," Maya said quietly. "We just have to remember that." That evening, Maya visited Sergeant Grant during her final night at Sentinel Ridge. Grant was being discharged the next morning, her infection markers finally clear. She was sitting up in bed, reviewing something on her tablet, and smiled when Maya entered. "I did something I probably shouldn't have," Grant said without preamble. "Old intelligence habits. I ran a background check on you." Maya's expression didn't change. "And what did you find?" "Gaps. 8 years of work history that doesn't show up in any civilian database. Before you became a nurse, you were somewhere the government doesn't want people asking about." Grant's eyes were sharp with understanding. "Combat medicine, I'm guessing. Probably surgeon level, given what I've watched you do." Maya finished checking Grant's vitals, her movements unhurried. "Some things stay classified. The person who sent me that text," Grant continued, "the one telling me about you. They said you were at Sentinel Ridge for a reason, that you don't run from fights." Maya met her eyes. "Someone I served with told me about this place, about what happens here, about people who need someone to stand up." Grant nodded slowly. "Then you should know. Hale's already started building a file on you. He's going to fabricate evidence. It's what he does." "Let him," Maya said. "I've faced worse than Victor Hale." The confrontation came on Thursday night at 2:37 a.m. The floor was quiet, most patients sleeping. When Maya entered the medication room to prepare a scheduled antibiotic, Hale was waiting inside. He closed the door behind her. "We need to discuss your future here," Hale said, his voice controlled but his body language aggressive. He positioned himself between Maya and the door, invading her space. "You're not fitting into our culture." Maya's posture shifted almost imperceptibly. Weight balanced, escape routes calculated, threat assessment complete. "I'm here to provide patient care. You're here to follow my directives." Hale stepped closer. "I've been reviewing your performance. There are concerns." "Documented concerns?" Maya's voice remained level. Hale's hand slammed down on the counter 6 inches from Maya's right arm, the sound explosive in the small space. "Don't play games with me. You think you're special. You think you can challenge me and walk away?" Maya didn't flinch. Her eyes stayed locked on his, reading every signal. The elevated pulse visible in his neck, the tension in his shoulders, the escalation pattern she'd mapped over 2 weeks of observation. She'd survived firefights in Kandahar. She'd performed surgery while evacuating under enemy contact. She'd stared down threats that would have broken most people. Victor Hale was dangerous, but he wasn't combat. "I need to prepare this medication," Maya said quietly. "Please step aside." Hale's face flushed crimson, but something in Maya's absolute stillness, in the complete absence of fear in her eyes, made him hesitate. He stepped back, his retreat disguised as choice rather than the instinctive response it was. "This isn't over," he said. Maya prepared the medication with steady hands. After Hale left, she stood alone in the medication room, and for the first time since arriving at Sentinel Ridge, she let herself remember the field hospital outside Kandahar, the officer who'd endangered patients with reckless decisions, her report, the retaliation that followed, the vow she'd made. Never again would she stay silent when people in power abused those who couldn't fight back. Someone she'd served with, someone who knew what she'd sacrificed, had told her about Sentinel Ridge, about the pattern of abuse, about the good people trapped in a system of fear. Maya hadn't come here to keep her head down. She'd come here to finish what she'd started years ago. Dr. James Portman found Maya in the staff parking lot at 7:15 a.m., just as her overnight shift was ending. The surgeon was 72 years old, with hands that still held steady during the most complex procedures and eyes that had witnessed 3 decades of military medicine. "Dr. Reeves," he said, his voice quiet but urgent. "I need 5 minutes of your time." They sat in his car, the November cold seeping through the windows. Portman pulled a weathered leather notebook from his jacket and placed it on the console between them. "I've been documenting Victor Hale's misconduct for 2 years, Portman said. "Every incident, every fabricated complaint, every person he's destroyed. Names, dates, witnesses. I have documentation of 11 careers he's ended through manufactured evidence." Maya's eyes moved to the notebook, then back to Portman's face. "Why are you showing me this?" "Because I'm retiring in 6 months, and I'm terrified this evidence dies with my departure." Portman's voice cracked slightly. "I've tried twice to bring this to the board. Both times my complaints were buried. Hale's brother-in-law sits on that board. He has relationships with 3 major defense contractors who fund this facility. He's protected from every angle. So why give this to me?" Portman met her eyes. "Because you're the first person in 3 years who's looked him in the eye and said no. Because whoever you were before you came here, you're someone who doesn't break." He paused. "And because I'm old and cowardly, and I need someone braver than me to finish what I started." Maya took the notebook, feeling the weight of 2 years of careful documentation. "He'll come after you for this. I'm retiring in April. He can't touch my pension. But you," Portman's expression hardened with concern. "He's already building a file on you. That's his pattern. Fabricate evidence. Destroy credibility before the target can expose wrongdoing. Let him build his file." Maya said quietly, "I've faced worse." The mass casualty drill was scheduled for Thursday at 1400 hours. A simulated terrorist attack scenario designed to test Sentinel Ridge's emergency response capabilities. 30 volunteers played wounded soldiers. Military evaluators observed from designated stations. The entire facility had prepared for weeks. The drill fell apart in the first 15 minutes. The defibrillator that should have been in Trauma Bay 2 was missing, cut from the equipment budget 3 months ago by Hale's efficiency initiative. When a simulated cardiac arrest occurred, the response team scrambled to locate backup equipment, while precious seconds ticked away. Maya saw the problem immediately. She sprinted to the adjacent surgical suite, retrieved their defibrillator, and had it operational in Trauma Bay 2 within 90 seconds. The simulated patient was saved. Then the portable ventilator failed, another casualty of budget cuts. Maya improvised with bag valve mask ventilation, coordinating a relay team to maintain airway support for 20 minutes until a replacement arrived from the main ICU. When the oxygen supply ran low because Hale had reduced PAR levels to cut costs, Maya reorganized triage priorities, identifying which patients required high-flow oxygen versus those who could be maintained on lower concentrations. By the time the drill ended, what should have been a catastrophic failure had been salvaged through Maya's tactical improvisation. The military evaluators noted exemplary adaptability under resource constraints. Hale's report to the board that evening credited the successful response to effective leadership and streamlined resource management. Maya's name appeared nowhere in the documentation. 3 days later, Private Jordan Chen was assisting Maya with a central line insertion when his hands started trembling. His breathing became rapid and shallow. Sweat beaded on his forehead despite the cool temperature of the procedure room. "I can't," Jordan gasped. "I'm sorry, I can't." Maya's voice shifted. It wasn't the gentle nurse's tone anymore. It was command voice, the one that cuts through chaos and demands attention. Jordan. Eyes on me. Right now. Jordan's panicked gaze locked onto hers. 4-count breathing. In through your nose. Hold. Out through your mouth. Follow my count. Maya's voice was absolute authority wrapped in calm. 1, 2, 3, 4. Jordan's breathing synchronized with her count. The panic began to recede. You're good at your job, Maya said, her tone still firm but warmer. Hale's campaign against you is about his control, not your competence. Do you understand me? Jordan nodded shakily. Then finish this procedure with me. Show yourself what you're capable of. 20 minutes later, the central line was placed perfectly. Jordan's hands were steady. The patient never knew anything had gone wrong. The summons came the next morning. Maya was reviewing patient charts when Beth handed her a printed memo on official hospital letterhead. Mandatory performance review. Dr. Maya Reeves' director's office. 1,600 hours, attendance non-negotiable. Beth's face was pale. Maya, this is how it starts. The review where he presents fabricated documentation and gives you the choice to resign or be terminated. Maya folded the memo and slipped it into her pocket. Her expression was calm, but something flickered in her eyes. Not fear, anticipation. Then I guess we'll see what he's built, Maya said. What neither of them knew was that Maya had spent the last 3 nights making encrypted phone calls to numbers that didn't appear in any civilian directory. That she'd uploaded Portman's documentation to secure servers that existed outside Hale's reach. That the warrior underneath the nurse's scrubs was finally preparing to fight back. Hale's office occupied the top floor of the administrative wing, all glass and polished steel designed to intimidate. When Maya entered at exactly 1,600 hours, he was sitting behind his desk with a manila folder opened in front of him like evidence at a trial. Sit down, Dr. Reeves. Maya remained standing. I prefer not to. Hale's jaw tightened, but he pressed forward. I've completed a comprehensive review of your performance over the past 3 weeks. There are significant concerns. He slid the folder across the desk. Maya didn't touch it. On November 8th, you administered a medication dosage that contradicted physician orders, Hale said, his voice taking on the tone of a prosecutor. On November 12th, you failed to properly document a patient assessment. On November 15th, you questioned a physician's judgment in front of medical students, undermining our educational mission. Maya finally looked down at the folder. The documentation was meticulous. Dates, times, witness statements from staff members she barely recognized. It was a masterpiece of fabrication. Each lie carefully constructed to sound plausible. She recognized the tactic immediately. Destroy credibility before the target can expose wrongdoing. Create enough doubt that when the victim speaks truth, no one will believe them. These allegations are false, Maya said quietly. Are they? Hale leaned back in his chair, his confidence absolute. I have documentation. I have witnesses. What do you have? Maya met his eyes with that same unshakable calm. The truth. Hale's smile was predatory. The truth is what I document it to be. You're a good nurse, Dr. Reeves, when you're not being insubordinate. So I'm going to offer you a choice. You can resign quietly. I'll write you a neutral reference, and you can find employment elsewhere. Or you can fight this, and I will terminate you for cause, report you to the nursing board, and ensure that every military healthcare facility in this country knows exactly why you were dismissed. The silence stretched between them. Maya could hear the distant sound of a helicopter landing on the roof pad, the steady thump of rotors that once meant incoming wounded. I need 48 hours to consider my options, Maya said finally. Hale's smile widened. He thought he'd won. You have until Monday at 800. Come prepared to sign resignation papers or face formal termination proceedings. Maya left his office without another word. She walked through the administrative wing with the same measured calm she'd maintained for 3 weeks, but inside, something was shifting. The warrior who'd performed surgery under mortar fire was done observing. That night, alone in her apartment, Maya made phone calls using a number that couldn't be traced through civilian systems. She spoke in language that suggested tactical briefings, not medical consultations. Terms like pattern of behavior and actionable intelligence and protective measures for personnel at risk. Someone on the other end of those calls listened carefully and began making their own calls. The emergency broadcast came at 0247 hours on Saturday morning. Maya was in the middle of her overnight shift when the trauma alert sounded through the hospital. Inbound via medevac. Special Forces operator. Multiple GSWs. Hemorrhagic shock. ETA 4 minutes. The trauma bay erupted into controlled chaos. Maya was the senior nurse on duty. She coordinated the team with precision. Blood products ready, surgical packs opened, airway equipment staged. The helicopter landed with a roar. The patient rolled through the doors on a gurney, and Maya's breath caught for just a fraction of a second. The soldier was barely conscious, his uniform soaked crimson. 3 gunshot wounds, chest, abdomen, thigh. His blood pressure was dropping. His skin was gray. He had minutes, maybe less. "I need 2 large-bore IVs now," Maya called out, her voice carrying absolute authority. "Type O-negative blood uncrossed. Get me 4 units running wide open." The attending trauma surgeon arrived within 60 seconds, already gowned. Dr. Sarah Chen was brilliant under pressure, but even she looked shaken by the extent of the injuries. "This is bad," Chen said quietly as she assessed the wounds. "We need to get him to OR immediately. Bay 3 is prepped," Maya confirmed. "Anesthesia is on the way." They were transferring the patient when Victor Hale walked into the trauma bay, summoned by the commotion. His eyes swept the scene, landing on Maya with that particular expression she'd learned to recognize. He was looking for mistakes, for any error he could document and weaponize. He followed them to the operating room. Maya scrubbed in alongside Dr. Chen and the surgical team. Through the glass observation window, she could see Hale taking a position where he could watch everything. His arms were crossed. His expression was predatory. The soldier on the table was dying. His heart rate was erratic. His oxygen saturation was dropping despite maximum ventilation support. "We're losing him," Dr. Chen said, her voice tight with tension. "Maya, I need..." And in that moment, with a life hanging in the balance and Victor Hale watching for any reason to destroy her, Dr. Maya Reeves let the mask drop. Her hands moved with battlefield precision as she prepared for the impossible surgery that would either save the soldier's life or give Hale exactly what he needed to end her career forever. The Special Forces operator was 24 years old. His name was Staff Sergeant Michael Croft. His heart was failing. Dr. Chen's hands hovered over the chest wound, her face pale behind her surgical mask. The bullet fragmented. There's shrapnel in the right ventricle. "If I go in there, you have to," Maya said, her voice carrying an authority that made Chen's eyes snap to hers. "He's got 5 minutes before the heart wall ruptures completely. Maybe less." Through the observation window, Hale leaned forward, watching. Maya's hands moved with precision that seemed impossible for someone who was supposedly just a trauma nurse. She didn't wait for instructions. She anticipated them. "Suction," she called out, already positioning the instrument. "I need better visualization of the inferior vena cava. Retractor." Dr. Chen found herself following Maya's lead rather than directing it. The dynamic in the OR had shifted. Maya wasn't assisting anymore, she was orchestrating. The shrapnel was embedded deep in cardiac muscle. One wrong move and the patient would exsanguinate on the table. Dr. Chen's hands began to tremble. "I can't. The angle is impossible." Maya's voice cut through the rising panic. It was command voice now, the tone that had once directed field surgeons in combat zones, while explosions shook the walls. "You can. Approach from the lateral aspect. Use your left hand to stabilize the tissue plane. I'll maintain cardiac position." Maya's hands moved into the surgical field, with movements that shouldn't have been possible for a nurse. She wasn't just assisting. She was performing advanced cardiac technique that required years of specialized training. Her fingers found the shrapnel. 1 piece, 2 pieces, 3. Each extraction was surgical poetry, controlled, precise, leaving minimal tissue damage. The kind of work that came from muscle memory built in places where hesitation meant death. Sutures. 5-0 proline. Now, she repaired the ventricular wall with stitches so perfect they could have been used in a textbook. The heart rhythm stabilized. Blood pressure climbed. Then the patient's oxygen saturation dropped catastrophically. "Tension pneumothorax, left side," Maya announced before the monitors even alarmed. Her hands were already moving, grabbing a 14-gauge needle. "I need to decompress now or we lose him." She found the intercostal space by touch, angled the needle with battlefield precision, and released the trapped air. The hiss was audible. The patient's oxygen levels climbed immediately. Dr. Chen stared at her. So did the anesthesiologist. So did every person in that operating room. Through the glass, Hale's expression had shifted from predatory anticipation to confusion to something that looked like recognition. His arms uncrossed. He leaned closer to the window, his eyes narrowing. The surgery took 97 minutes. When Staff Sergeant Croft's vital signs finally stabilized and he was transferred to the ICU, the OR team stood in stunned silence. Dr. Chen pulled her mask down. Her eyes locked on Maya. "Where did you learn to do that?" Maya was stripping off her gloves, her expression returning to that calm neutrality. "Do what?" "That wasn't nursing. That was advanced combat surgery. Trauma techniques I've only read about in military medical journals." Before Maya could respond, the OR doors opened. Victor Hale entered, his face unreadable but his eyes burning with questions. "Dr. Reeves," he said, his voice tight with barely controlled suspicion. "A word. Now." They stood in the corridor outside the OR, still in surgical scrubs. Hale positioned himself between Maya and the exit. Old intimidation habits. "Where did you learn to do that?" His voice was low, dangerous. "That wasn't civilian medicine. Those techniques, I've seen military surgeons with 20 years' experience struggle with procedures you just performed like reflex." Maya met his eyes with that same unshakable calm. "Where it mattered most." "That's not an answer. It's the only one you're getting." Hale's jaw clenched. "I'm going to find out who you really are, what you're hiding, and when I do..." "You'll what?" Maya's voice was quiet, but something in it made Hale take half a step back. "Fabricate more documentation? Threaten my career? You've already done that." She walked past him toward the locker room, her shoulder brushing his as she passed. A deliberate challenge. In the locker room, Maya sat on the bench, her hands steady despite the 97 minutes of impossible surgery. She pulled off her surgical scrub top, reaching for her civilian clothes. That's when anyone watching would have seen it. The tattoo on her left shoulder. Black ink, precisely detailed. The caduceus, medical symbol of healing, crossed with 2 rifles. Beneath it, words in Latin. In bello salus. In war, healing. It was the insignia of the Army Medical Corps, but beneath it was something more specific. The tab and crest of the 75th Ranger Regiment Medical Support. Maya had served in the most elite combat surgical unit in the United States military. She traced the tattoo with one finger, remembering. Then she dressed, tied her hair back, and walked out to finish her shift. Victor Hale had no idea what he'd just unleashed. Sergeant Amelia Grant found Maya outside the ICU as dawn filtered pale and cold through the hospital windows. Grant moved more slowly now, still recovering, but her eyes were clear and steely. "I know who you are," she said quietly. Maya held her gaze, a flicker of pain and old discipline passing over her expression. Grant continued in a lower tone. "You were Doc Blue in Afghanistan, 75th Ranger Regiment Medical Support. You operated on the ground, not just in the field hospitals. It wasn't a question." Maya hesitated just long enough to confirm it. "How did you, Old networks. Word gets around. Especially when someone saves as many lives as you did. But you also reported a commanding officer for risking patient safety. Punished for it, too. Forced out on a technicality." A ghost of a smile tugged at Maya's mouth. "That was a lifetime ago. It matters now. You know how to handle a fight in the shadows." Flashback. Maya remembered Kabul. Mortars shrieking overhead. Blood pooling in dusk-lit makeshift wards. Surgeons collapsing from exhaustion. Through chaos and fear, Maya's hands had been steady. They called her Doc Blue for her steel, and for the blue field cap she never lost. She'd left the military not because she was broken, but because the system punished integrity. Maya's report on a superior's reckless orders had set in motion an invisible war of paperwork and whispers. She vanished from the Army's roster, but not from the duty to protect those who couldn't protect themselves. Back in the present, Grant's voice took on an edge. "You're up against the same kind of power here, but you're not alone this time." Meanwhile, Victor Hale finally unearthed Maya's true background, her deployments, her awards, her discharge, and panic replaced arrogance. He called for an emergency administrative hearing. determined to act before Maya could rally any further support or expose his schemes. Hale's plan was swift: terminate Maya's contract, strip her credentials, and erase any chance for retaliation. Over the weekend, he leaned on his network, prepped talking points, and stacked his hearing panel with loyalists. But Maya was not passive. She gathered Dr. Portman's records, Beth's direct witness, and the now-recovered Jordan Chen, whose anxiety had subsided after their last shift together. She built a small, determined coalition prepared to speak up. On Monday morning, Maya checked her secured email. 2 new messages awaited. One was from Grant, promising to testify as a patient and as a senior NCO in the U.S. Army. "You saved my life. I'll say it on the record." The other subject line was terse but electric. "Coming in person. Arriving with a friend. Be ready. SM." By midday, the administrative hearing room was packed. Board members, legal observers, and staff nervously attending. Hale entered in his best suit, but his eyes darted with uncertainty. Maya's coalition waited quietly, Portman clutching his notebook, Beth holding copies of erased incident reports she'd recovered from hospital archives, and Grant standing with her new prosthetic, medals unobscured on her uniform. Jordan Chen sat near the door, no longer trembling. Outside, 3 officers in full military dress uniforms walked through Sentinel Ridge's main hall. At their head was Colonel Sarah Mendez from Army Medical Command, accompanied by a tall, silent figure in a Pentagon-issue suit. The hearing began with Hale's opening salvo, but as Maya took a deep breath, she knew the balance of power was about to change. The room's attention shifted as the colonel stepped forward and announced, "Before you proceed, I have a statement for the panel on Dr. Maya Reeves's service and heroism under fire." The truth was finally poised to break the silence. The knock on Maya's apartment door came at 06:30 hours on Monday morning, 3 hours before her scheduled termination hearing. When she opened it, she found Dr. Portman, Beth Carrington, Private Jordan Chen, and 5 other staff members standing in the hallway. Beth spoke first, her voice steady despite the fear in her eyes. "We're coming with you." Maya shook her head. "You'll lose your jobs. All of you. Hale will make sure of it." "Then let him try. Dr. Portman stepped forward, his weathered face set with determination. "I've been a coward for 2 years, watching good people destroyed while I kept my head down and counted the days until retirement. I'm done being that person." Jordan Chen's voice was quiet but firm. "You taught me that fear is only a tool if we give it power. I'm not giving it power anymore." One by one, they spoke. Lisa Park, the respiratory therapist Hale had cornered, a surgical nurse who'd witnessed fabricated documentation, a physician's assistant who'd been threatened into silence. Each carried documentation, recordings, witness statements, evidence they'd been secretly preserving, waiting for someone brave enough to stand up first. Maya felt something crack inside her. The protective wall she'd built to fight this battle alone. "You understand what this means? There's no going back." "We know," Beth said, "but some things are worth fighting for. Dignity, truth, the right to care for patients without fear. You showed us that." The administrative hearing room was packed when they arrived. Hale sat at the head table flanked by 3 board members he'd personally selected, loyalists who owed their positions to his influence. He wore his best suit, his expression confident, his fabricated evidence organized in neat folders. He barely glanced at Maya's coalition filing in behind her. He'd destroyed so many careers that he'd stopped seeing them as threats. The hearing began with procedural formalities. Then Hale launched his attack, his voice smooth and professional as he presented his case. "Dr. Reeves has demonstrated a pattern of insubordination and clinical errors that compromise patient safety," Hale announced, sliding documentation across the table. On November 8th, she contradicted physician orders. On November 12th, she failed to properly document critical assessments. On November 15th, "May I respond?" Maya's voice was calm, but carried an authority that made the board members look up. Hale's jaw tightened. "When I've finished presenting evidence, I'd prefer to address each accusation as you make it, with documentation." The board chair, one of Hale's allies, started to object, but Maya was already placing time-stamped medical records on the table. Charts showing her judgment had been correct. Lab results proving her assessments were accurate. Physician signatures confirming her actions saved patients. For every fabricated accusation Hale presented, Maya produced evidence that exposed it as a lie. Hale's confidence began to crack. His voice rose. His gestures became aggressive. When Maya presented documentation proving he'd backdated an email to manufacture a policy violation, his face flushed crimson. "This is absurd," Hale snapped. "You're manipulating records." "Then let's ask the witnesses," Maya said quietly. Dr. Portman stood. "I've documented Director Hale's pattern of fabricating evidence for 2 years. I have 11 cases where he destroyed careers through manufactured violations." Beth spoke next, her voice clear despite trembling hands. "I recovered incident reports from hospital archives that were deleted from the system after staff filed complaints against Director Hale." Jordan Chen presented his own evidence of threats and psychological abuse. Lisa Park testified about the ventilator protocol Hale had claimed not to update. One by one, Maya's coalition presented a systematic dismantling of Hale's credibility. Hale exploded. He stood, slamming his hands on the table, his professional veneer shattering completely. "This is a conspiracy. These people are lying because they can't accept authority. I have run this facility with excellence for 3 years, and you're going to believe a nurse who's been here 3 weeks?" The board members exchanged glances. They were seeing the real Victor Hale, the tyrant who ruled through fear and intimidation. "Dr. Reeves has no authority to question my decisions," Hale continued, his voice rising to a shout. "She's insubordinate, she's—" The hearing room doors opened. 3 officers entered in full military dress uniforms. At their head was Colonel Sarah Mendez, her insignia marking her as Army Medical Command. Behind her stood a Pentagon official and Staff Sergeant Michael Croft, the Special Forces operator Maya had saved, in his Class A uniform. Colonel Mendez's voice cut through the tension like a surgical blade. "Before you proceed further, this panel needs to hear the truth about Dr. Maya Reeves's service record and why she's really at Sentinel Ridge Military Hospital." Every eye in the room turned toward the colonel as she approached the front table, carrying a sealed military file marked "Classified." Colonel Sarah Mendez placed the classified file on the table with deliberate precision. Her uniform bore the insignia of Army Medical Command, ribbons spanning 2 decades of service, and the kind of presence that made even Hale's hand-picked board members sit straighter. "My name is Colonel Sarah Mendez, United States Army Medical Command," she began, her voice carrying the weight of absolute authority. "I'm here to provide testimony regarding Dr. Maya Reeves's military service record and to correct several dangerous misunderstandings about her qualifications." Hale's face had gone pale. "This is highly irregular. We're conducting an internal. This facility receives Department of Defense funding and serves active-duty military personnel," Mendez interrupted, her tone brooking no argument. "That makes Dr. Reeves's military credentials relevant to this proceeding. You will hear what I have to say." She opened the file, revealing commendations, deployment records, and photographs that told a story no one in that room had known. Dr. Maya Reeves served 12 years as a combat surgeon with the 75th Ranger Regiment Medical Support, Mendez continued. She completed 3 combat deployments to Afghanistan. She performed over 200 field surgeries under fire. She was decorated for valor after saving 17 lives during a coordinated enemy assault on a forward operating base. The room had gone completely silent. Beth's hand covered her mouth. Dr. Portman's eyes were wet. Even the board members leaned forward, transfixed. "In military medicine, we have a saying," Mendez said. "There are surgeons who work in hospitals, and there are surgeons who work in hell. Dr. Reeves worked in hell, and she was the best we had." She turned to face Hale directly. "So when you claim she's incompetent, when you fabricate documentation about her clinical judgment, you're not just attacking a nurse. You're attacking one of the finest combat surgeons the United States Army has ever produced." Staff Sergeant Michael Croft stepped forward, moving slowly but steadily in his dress uniform. His voice was rough but clear. "Colonel Mendez is my aunt," he said. 3 weeks ago, I took 3 bullets in a classified operation. I was dying. Multiple surgeons told my team I wouldn't make it to the OR. But Dr. Reeves," his voice cracked slightly, "she saved my life with techniques I watched trauma surgeons in Kandahar struggle to perform. She's a miracle worker, and you're trying to destroy her," Mendez continued, her voice hardening. "Dr. Reeves left active service not because of incompetence, but because she reported a commanding officer for medical malpractice that endangered patients. She filed a formal complaint when a superior officer ordered her to perform unnecessary surgeries to inflate performance metrics. Soldiers died because of those orders. Dr. Reeves spoke up. The board members exchanged shocked glances. What happened next was institutional retaliation, Mendez said, her words landing like hammer blows. Her career was systematically dismantled through bureaucratic warfare. She was forced out. But the Army's Inspector General eventually vindicated her completely. Every accusation against her was proven false. Every action she took was proven correct. She placed a document on the table. An official Army investigation report with exonerated stamped across the top. Dr. Reeves learned what happens when powerful people punish integrity, Mendez said quietly. She learned that speaking truth can destroy your career. But she also learned something else. That some fights are worth having, no matter the cost. Hale found his voice, though it came out strangled. This is all very moving, Colonel, but it doesn't change the fact that Dr. Reeves violated hospital protocols. I have documentation proving otherwise, Dr. Portman interrupted, standing with his leather notebook. 2 years of evidence showing Director Hale's pattern of fabricating violations to destroy staff who challenge him. He placed the notebook on the table, and Beth added her recovered incident reports. Jordan Chen presented his documentation of psychological abuse. Lisa Park testified about fabricated policy changes. The board members began reviewing the evidence, their expressions shifting from confusion to shock to something close to horror. Hale's voice rose to a desperate shout. These people are lying. They're coordinating false testimony because we're tired of being afraid, Beth said, her voice trembling but clear. Because Maya showed us that silence isn't the only option. Because someone finally had the courage to stand up, and we're not letting her stand alone. The board chair, one of Hale's supposed allies, raised his hand for silence. His face had gone ashen as he read through Portman's documentation. Director Hale, he said slowly, this hearing is suspended pending a full investigation. You are relieved of your administrative duties effective immediately. Hale's expression cycled through disbelief, fury, and finally something close to panic. You can't... I have connections. The board will never... The board, the chair interrupted, will be very interested to learn about systematic fabrication of evidence, workplace harassment, and the creation of a hostile environment that has cost this facility millions in turnover and liability. Security officers appeared at the door. The Pentagon official who'd accompanied Colonel Mendez spoke for the first time, his voice cold and bureaucratic. The Defense Department will be conducting its own review of this facility's management practices and compliance with military healthcare standards. Director Hale, you're required to surrender your credentials and vacate the premises immediately. The walk through Sentinel Ridge's corridors was Maya's vindication made visible. Staff members emerged from offices and patient rooms to watch Victor Hale escorted out by security. No longer the tyrant who'd ruled through fear, just a man in an expensive suit whose power had finally run out. Maya stood with her coalition, exhausted but unbowed. Colonel Mendez approached and saluted. A gesture of respect between warriors. Welcome back to the fight, Doc Blue, Mendez said quietly. The real fight. The one for people who can't protect themselves. Maya returned the salute, her eyes bright with emotions she'd held back for 3 weeks. It's good to be back, ma'am. 2 months passed like seasons changing. Slowly at first, then all at once. Sentinel Ridge Military Hospital had a new director by January. Dr. Helena Ortiz came from Walter Reed with a reputation for transparency and a command philosophy built on respect rather than fear. Her first act was to hold an all-staff assembly where she stood without a podium, without notes, and spoke about dignity, accountability, and the culture they would build together. The changes were visible everywhere. Staff walked the corridors with their heads up. Voices in meetings carried questions and suggestions instead of silent compliance. The turnover rate dropped by 60% in 6 weeks. Patient safety metrics climbed steadily as nurses felt empowered to speak up about concerns without fear of retaliation. The investigation into Victor Hale's tenure resulted in 17 formal complaints, 11 cases of fabricated documentation, and a referral to federal authorities for fraud in defense contracting relationships. Hale himself vanished from military healthcare entirely, last reported working in medical device sales in another state. his power reduced to memory. In late January, Dr. Ortiz called Maya into her office. The space looked different now. The intimidating glass walls replaced with softer lighting, family photographs on the desk, medical journals stacked beside a coffee mug that read, "Leadership is service." "I have a proposition," Ortiz said, gesturing for Maya to sit. "We need a chief of trauma surgery. Someone with combat experience, exceptional clinical judgment, and the courage to build a department culture based on excellence without fear." Maya's expression shifted slightly. Surprise, then consideration. "That's a significant role." "You're a significant surgeon," Ortiz replied. "Your military record speaks for itself. But more importantly, what you did here, standing up when no one else could, that's the kind of leadership this facility needs." Maya was silent for a long moment, her fingers tracing the edge of the chair arm. "I accept. On one condition." "Name it." "I mentor the next generation. Residents, young surgeons, medics like Jordan Chen who need someone to believe in them when they stop believing in themselves." Ortiz smiled. "That's not a condition. That's exactly what I was hoping you'd say." Private Jordan Chen graduated from his advanced medical training program in early February with honors. At the ceremony, when the program director asked him to say a few words, Jordan's voice was steady and clear. "6 months ago, I didn't think I'd make it through this program," he said. "I let fear control me, but someone showed me that fear is only a tool if we give it power. Dr. Reeves believed in me when I couldn't believe in myself. This achievement isn't just mine. It belongs to everyone who refuses to stay silent when they see injustice." Maya sat in the audience beside Beth Carrington, who'd been promoted to chief nursing officer. Beth squeezed Maya's hand as Jordan spoke, both women understanding the weight of those words. Beth's first major initiative was a hospital-wide program on workplace dignity and reporting mechanisms, anonymous channels for complaints, mandatory training on psychological safety, and a zero-tolerance policy for retaliation. Maya served as an advisor, her experience with both institutional courage and institutional betrayal making her perspective invaluable. Dr. Portman retired in April with a celebration that filled the hospital's main conference room. At 72, his hands finally ready to rest, he stood before colleagues and spoke about Maya's impact. "I spent 2 years documenting abuse and was too afraid to act," he said, his voice thick with emotion. "Maya Reeves showed me that documentation without action is just well-organized cowardice. She gave all of us, the courage to stand up. That's the legacy I'm taking into retirement." On a Tuesday morning in late April, Maya stood in operating room 3 wearing full surgical gear, teaching a complex vascular repair technique to 6 surgical residents. Her hands moved with the same battlefield precision, her voice carrying the same calm authority that had once guided field surgeons through mortar fire. But this was different. This wasn't survival surgery under enemy contact. This was teaching in a place where healing wasn't threatened by fear, where competence was celebrated instead of punished, where speaking truth didn't cost careers. "The key is anticipation," Maya explained, her eyes on the surgical field. "You read the tissue, predict complications before they manifest, and stay 3 steps ahead. In combat zones, we called it tactical medicine. Here, it's just excellent patient care." A young resident named Dr. Sarah Kim asked a question about alternative approaches. Maya smiled. The kind of question that would have been dangerous under Hale's regime was now exactly what she wanted to hear. After the surgery, Maya walked to the staff lounge and poured coffee as dawnlight filtered through the windows. She stood looking out at the hospital grounds, the same view she'd seen on her first day, but transformed by everything that had happened since. Some battles aren't fought with weapons. Some warriors wear scrubs. And some victories happen when one person refuses to stay silent, then teaches others they don't have to be silent either. Maya thought about her mother's promise, about the field hospital in Kandahar, about every person who'd ever been crushed by power and convinced they deserved it. She'd kept her promise. She'd stood up, and she'd helped others find their own strength to stand. The smile that crossed her face was small, but genuine. The expression of a warrior finally fighting the battle she was always meant to fight. Not against bullets and explosions, but against cruelty dressed as authority. Against fear disguised as policy. Dr. Maya Reeves took a sip of her coffee and turned back toward the surgical wing, ready for whatever came next. because some fights never end. They just find new battlefields, and she would always be ready.